Hello again, and welcome to another episode of Human Rights Magazine. In this episode, Kristina Kulessa explores the issues of the Syrian crisis and the gender-based violence against women and girls, including those living as refugees in Turkey and those internally displaced within Syria.
Gender-based violence targets women and girls in the largest forced displacement crisis in the world, with almost 14 million Syrians in need of humanitarian assistance. A rise in gender-based violence and sexual violence affects vulnerable groups, particularly Syrian women and girls. I interviewed a few experts to talk about this crisis. My first interviewee is Marta Perez del Pugar, who was UNFPA's deputy representative in Syria between 2016 and 2018, and worked closely with Syrian women and girls amidst the crisis and with the internally displaced persons inside Syria. As I mentioned, it's been 10 years now. It's been a very long time. How would you compare the situation when you worked there and now?
Okay, I think it's an extremely complex crisis with so many foreign interests that are playing their cards on the ground. And this has also implications in the way in which the conflict can be understood, because also the way in which it's projected in media, and therefore the way in which it's modeling public opinion with regards to the conflict. And in most cases, women are nowhere to be seen, systematically silenced. We're not in the media. We are not part of the discussions. The fact that there's a women caucus is almost invisible whenever you read any news outlets about the Syrian conflict. And I think this has a lot to do with the way in which the different parties are using informations coming out of Syria to feed into their own interests and messages.
The role of the media in shaping public opinion has definitely become increasingly important, particularly with significant issues like gender-based violence. While in Damascus, you were leading the UNFPA program as part of the response operation from inside Syria. How was the experience working with the government and with Syrian counterparts in tackling gender-based violence?
The Syrian law is what applies. So there were difficulties, not because there was resistance, but because in many cases there was either lack of understanding of what it actually meant and what the risks actually were. And also because there was so much to do that this lack of understanding about the specific risks that some women and girls face were not on the top of the agenda, not because they were not important, but because people were carried away by other duties and responsibilities that they had.
It must have been difficult working around the Syrian law. What was it like working with the government on gender-based violence prevention?
On one hand, it was positive that there was the will to have in place systems for GBV prevention and response, but on the other hand, the different ways in understanding how this should be done vis-a-vis the international standards, it did become sensitive and difficult to manage at some points. And I'll give you an example. The government was very keen in setting up shelters, let's say, where the women would be brought in, survivors of GBV, would be brought in and receive all services, which meant that they were basically confined in an internment center, which goes completely against international standards. Unless it's strictly life-saving, services should be outside, their children should be able to go to school, should be with them, they should be able to be in and out.
Since working with the government was very difficult, given the limitations, what was UNFPA's role in gender-based violence prevention within Syria?
What UNFPA and partners actually had was a network of, I can't remember how many, but over 20 women and girl safe spaces. These safe spaces provide comprehensive services, including in many cases sexual and reproductive health services, legal counseling, psychosocial support, trainings. It could be computer literacy, language literacy, some vocational training, which could be not very gender transformative from my point of view, because it was normally there's sewing and cooking, hairdressing, but they would really enjoy that it was a safe place for them to come together, talk about their issues, spend some time for themselves. Some of them had a gym, which was in the ones where there was a gym, women were super happy with it because it was their way of being able to move. They were most of the time stuck at home. So it was also a place for them to find peer support and reconstruct their lives. In addition to the fact that it also have a component of peaceful coexistence and social cohesion, because in many occasions, the women receiving those services, they were either IDPs, some were from the host communities. So it was also contributing to that, while at the same time, in accordance with GBV standards, specialized GBV services were being provided with confidentiality, safety, and non-discrimination.
When Syrian refugees and survivors, particularly these women and girls that come to these women and girls safe spaces you just mentioned, what were the main issues they came with or that needed to be tackled? And how can they be tackled? For example, through empowerment?
A very high proportion of the population in Syria is traumatized. And there is a problem. In Syria, there is no psychosocial support as such. Everything falls under mental health and it's highly medicalized. So providing these spaces for peer support, for some psychosocial support, for people to find peace, to feel safe, to be able to interact, not to be judged, not to feel threatened, that is already huge.
What would you say made it especially difficult to provide social services to those that came to the women and girls safe spaces?
Now, we also need to understand that there were social dynamics prior to the conflict that have been exacerbated due to the conflict, which is a very strong patriarchal society.
Yeah.
With gender roles that have changed because men have left, men have died, men are at war, or men are now disabled because they have suffered some kind of injury. Women have been left alone, dealing with everything, dealing with earning. They have become farmers, they have become fighters, they have become the breadwinners, when they had been actually being brought up to get married and raise a family. So those roles have also changed.
Has anything else contributed to this very profound social transformation you talk about in Syria?
In addition to that, there are no sufficient men for all the women who want to marry to actually marry. So that's also contributing to a very profound social transformation that we will still need to see where that goes, but that it's very linked to your question on empowerment of women and girls. It is about empowerment, but it's beyond that. It's also about understanding the deep changes that the conflict is having in the social structures and in the power dynamics, in the gender power dynamics and in social norms. Now, if we continue training women as hairdressers in a country that needs to be rebuilt, what they need are plumbers, brick makers,
like construction, infrastructure.
Exactly. That's the future of the jobs in Syria. And there are going to be no men to do those jobs. I mean, there are men, but there aren't that many men to do those jobs. So for women to also understand and see themselves from a different position, that also requires a transformation, and we cannot expect that to come alone.
This social transformation will become very significant to the future of Syria. I wonder, how do the social norms such as child marriage in Syria influence the ways in which you had to operate and structure your programs?
Okay, on one hand, child marriage was very much common in Syria before the conflict. What the conflict has done has exacerbated child marriage and the ways in which child marriage happens in the country. So it's very hard to argue with Syrian women and with Syrian adolescent girls about child marriage because they are not the ones who decide in most cases.
How would you argue with the best way to tackle this issue?
Given the social transformation that is happening in the country, working with men and boys is definitely should be at the core, but working with men and boys towards gender equality and for those gender transformations in supporting women and girls.
So what would you say contributes to the increased rates of gender-based violence and the need for aid or humanitarian aid?
There are standards. You do not need to conduct an assessment to know the incidence nor the prevalence of GBV before taking action on GBV risk mitigation, prevention, and response.
Okay.
Because you know it happens, whether it's evident or not, you know it's happening, but it's probably hidden. Now, Syria has all the factors that should be contributing to increased GBV, one, in all its forms.
Like conflict itself often can lead to GBV.
But it's also increased poverty. It's also increased lack of social networks. It's also impunity of the perpetrators. It's also to be surrounded by constant, systematic, and normalized violence in all its forms. The country is at war, right? So violence is everywhere. GBV is just another kind of violence surrounding people on their day-to-day when they have to survive. And when there is increased tension. People are poor, people are tired, people are afraid. So all that creates violence. That's one. Second, there are, so the social patriarchal norms that were discriminatory, that existed prior to the conflict, are the ones that have also been exacerbated. And this has implications for what we call the negative coping mechanism.
What are some examples of negative coping mechanisms?
Many people think that their daughters will be better protected if they are married early. I was talking to a girl. She was 12, from a remote area in a village. So there was a school in her village, so she was kept in school. The year after, she was already moving to high school. High school was in the city. Okay. And her family did not have the money to pay for her transportation to go to school. So she was saying, what are they going to do with me? I'm at home, I cannot work, they will marry me off. And I don't want to. She was really upset. She was screaming, crying. She was very nervous. It was hard. So that is with relation to poverty. It's a negative coping mechanism.
They feel they have no choice.
Well, they could explore the other alternatives, but child marriage is so much installed in the society that they don't think about other alternatives. Then we also have the case of what were called the serial marriage. So basically, under the Sharia law, for anyone to be able to have sex has to be married. What they would do is that they would have they would marry the girl or the woman, have sex, and divorce the day after. So if you look at child marriage, we're not talking about one same thing. There are different forms, there are different reasons. In some cases, it's a negative coping mechanism. In other cases, it's a social norm. In other cases, it's flagrant sexual exploitation and abuse.
Has there been improvement with regard to dealing with gender-based violence in Syria?
Basically, laws that say how much you can inherit, who you can marry, from whom do you need permission to get married. They were extremely discriminatory. They have changed. Among other things, the age for marriage has been risen to 18. And that's very important.
What do you think needs to be done?
Instead of referring women to another center and to another center for the provision of different specialized services, start thinking, now that the situation is more stabilized, on how to provide more comprehensive, holistic services for women. Definitely, as much as possible, trying to avoid the shelters. So if a woman goes to the doctor because she's been raped, the doctor is obliged to report, even without the consent of the woman. So many women were afraid to seek medical assistance.
Yeah.
And they were therefore not receiving the services within the package of the comprehensive management of rape. So, but that is also part of adhering to international protocols and standards.
Yeah.
So that's definitely something to continue working on, continue working in developing the capacities of civil society organizations, and at the national, but also at the subnational level. For GBV, definitely male engagement and working with men and boys, working with community and religious leaders, definitely. And also shifting the paradigm of the empowerment of women, looking at new social norms, new opportunities for empowerment, and leveraging those.
Yeah.
And not just providing livelihood initiatives, teaching them how to use a blow dryer.
Thank you so much for your time. This concludes the interview with Marta Delver Perez Pulgar. Our next speaker is Jennifer Miquel. She has 18 years of experience in development and humanitarian contexts at the United Nations and international NGOs. My first question for you is, how has the crisis developed over the years?
You know, the crisis in Syria is still very much going on. Actually, more people in need than there has been this year than there has been in the past years. So the situation is worse. And then you have all these refugees that are that have fled Syria. So you know that they're mostly in Turkey, in Jordan, Lebanon, and Iraq, right? And a little bit in Egypt. And there's still about 5.5 million, 5.6 million refugees throughout the region.
What are some of the main issues affecting Syrian refugees and survivors, particularly women and girls?
I mean, so gender-based violence.
Yes.
The one thing. But also, like, there's a huge economic crisis as well. And so, you know, when we ask what women and girls want and what they, you know, sort of, it's livelihood opportunities. So that's usually the top ask. And of course, I mean, safety and security and so forth, but usually top ask is livelihood opportunities. Now, I mean, this year, we continue to see things like domestic violence, sexual violence, harassment, early forced marriage, psychological abuse and denial of resources. So that continues to be all the types of violence that we see affecting mostly women and girls.
And what would you say contributes to the increased rates of gender-based violence and the need for humanitarian aid and UNFPA support?
So the things that lead to GBV or the even sort of increase, definitely, well, the crisis still, so the conflict,
the conflict in general
COVID, too. COVID, and the economic crisis. So those three are the main sort of contributing factors. Having said that, I mean, we're very clear as well that, I mean, GBV existed in Syria before the conflict as well. I mean, your sort of social structures break down. You also sort of your normal traditional protection mechanisms are also no longer there. You might be displaced. And so, you know, places that are like camp settings and are not always sort of set up with sort of a gendered lens or a lens that would mitigate the risks of GBV. So you have like latrines and so on that might be mixed, or you would have tents that are, you know, women and men aren't necessarily sort of separated. So there's just a lot of different there's just a lot of different contributing factors, that can, there's less law and order, there might be more violence, society, the laws do not favor women and girls.
No.
So you had that as a baseline, and then you had conflict, COVID, and economic crisis. It just makes the situation worse.
And what would you say is UNFPA's role in supporting the refugees from Syria?
So in terms of healthcare, we make sure that there are doctors and midwives and so forth are trained on how to respond to provide that clinical care to survivors, and then we also make sure that there's enough supply. So that means also emergency contraception, post-exposure prophylaxis to prevent the transmission of HIV, and then antibiotics, to prevent the spread of STIs.
Are there any social challenges that come with providing contraception?
Yeah, for sure. So adolescent girls, for example, or if you're not married, in many places you cannot access any contraception. A woman has to be married, and that makes it very difficult. One of the things that we've tried to do is as UNFPA, because we work on sexual reproductive health and gender-based violence, we try to make sure that a lot of the services that we provide are integrated. So for example, with the Women and Girls Safe Spaces, we're piloting in some places being able to provide family planning. And so through them, or sometimes in some locations, in some countries, we have sort of more comprehensive centers where on one side of sort of a facility, you'll have sort of comprehensive sexual and reproductive health services. And on the other side, in a little place a little bit more discreet, you have the Women and Girls Safe Space. Because also it's not really taboo to go and seek sexual reproductive health services in the region. Women go. Yeah. But sometimes it can be a little bit harder to go to Women and Girls Safe Spaces. So if they're linked, they can go without having to say, actually, I'm going to a Women and Girls Safe Space and going to hang out with other women.
Were there any difficulties implementing the programs?
What's very difficult, though, in most of the countries in the region is that you also have mandatory reporting. And what that means is that if a survivor goes to a doctor, then seeking healthcare, then the doctor is obliged and mandated to report that to the police. And that can be also, I don't know if you've heard this before, but that's something that's kind of common in a lot of countries, except that, and it comes from a very legal point of view, saying this isn't right. And, anyone that's, as a rapist has to go to jail, but it doesn't take a survivor-centered approach, right? It doesn't look at what does that woman need and what are her choices, because the act for sexual violence is incredibly disempowering. And what we try to do is ensure that the women that have experienced this are re-empowered and make the choices that they want in terms of how, of their needs, of their healthcare, of and so forth. So that's a little bit on the response side, but then we also try to look at the situation holistically and try to put in place prevention programs. So, there's so we start working on social norms. We also, sort of negative social norms that sort of perpetuate sort of the violence and patriarchy and so forth. But also one of the main interventions throughout the Syria crisis is Women and Girls Safe Spaces. And so it's a place that women and girls can come, rebuild social networks if they've been displaced and so on.
Can you tell me more about this Women and Girls Safe Space program?
We have over 100 Women and Girls Safe Spaces basically throughout the region. And then this is where women and girls can come, they can seek specialized care, but they also can meet other women, can hang out, can make friends, can choose activities, things that they want to learn, build their skills, etc. And of course, this is also just an opportunity for us to sort of talk about rights and share more information. The idea with these Women and Girls Spaces is that they're led by women and adolescent girls, I should say. And so that they get to make these decisions. Often we know that women may not have decision-making roles in the family in many aspects. And so this is a place where they can make decisions and so forth. We we also have very targeted programming now. So, and we focus a lot on adolescent girls. And because adolescent girls tend to be the ones that are most, of course, affected by child marriage, but also sexual violence and so forth. And so we have specific programs focusing on adolescent girls. And those all have an empowerment element. And we try to make sure that, we try to focus also on an aspirational element.
So, when these adolescent girls participate in your projects, at what point do they integrate into society? At what point can they step into the world and have a job or work or start fresh? Is there a point where this can happen?
I mean, I think it really depends on the girl. And I mean, I would say they're always kind of part of society, but so one of the things actually we're doing right now so in these women and girl safe spaces, as I mentioned before, women have the opportunity to build their skills and do activities and learn information and so on. And often then, and because there's an empowerment lens, they get to decide what activity there is. But the majority of the time they ask for like sewing or makeup, learning how to do makeup or hairdressing. But there are activities that kind of perpetuate these gender norms, right?
Yeah, so it just becomes a reinforcing cycle. How do you know that these programs are leading to positive outcomes for these women?
And one of the things that we do, we focus a lot also for understanding the situation GBV, but also sort of to monitor programs is qualitative data. So we ask women and girls what their opinions are. I mean, and men and boys. So with these annual impact assessments, we do focus group discussions, key informant interviews with service providers. We do client feedback forms, so like, that you get feedback at health facilities and women and girl safe spaces. And then overwhelmingly that what comes out, especially with the women and girl safe spaces, that there's no alternative to that. So if those don't exist, we're constantly told that there would be nowhere else that they could go. And we're constantly told that this provides, kind of a lifeline because there's nothing else like that. And one of the things that we also know, usually often women, and these women in girl safe spaces, I should say, it's not just for survivors of GBV, but for all women, so also women at risk of GBV and so on. But one of the things that we're also told by, women that experience violence is gender-based violence. Usually they keep quiet. They don't tell anyone. They don't sometimes more and more they know that they can access services, but because it's so taboo, because you could be ostracized, rejected from your family, wouldn't be able to marry anymore, etc.
Yeah, there are a lot of cultural factors that are important to take into account.
Exactly, sure. And so having this sort of space that's theirs and that's safe is something that they say that they really value, and they value it being for women and girls only.
What would you say are one of your most important accomplishments from the project that you've implemented for Syrian women and girls?
So I would say I'm very proud of the increased focus on adolescent girls, because I feel like this is one of the, in humanitarian settings, GBV is not always prioritized. And so more and more it is, and it's recognized that now we don't have to provide data to be able to have a response, and that's all much more accepted.
The increased focus on adolescent girls is definitely very important, and it's really great to see that there has been a lot of progress. As you know, the world has been hit with a global pandemic. So my question for you would be, how has COVID impacted the crisis and your progress?
Now, COVID-19, has been called the Shandro pandemic, as you probably have heard, has just made things worse, and certainly increased intimate partner violence, specifically in family violence. And of course, not just COVID itself, but it's all the restrictions and all the measures that have been put in place to try to limit the spread of COVID. So Syria had lockdowns as well, and services were closed. And, before COVID hit, there was always this there were plans and anticipation that up, from 250,000 to 500,000 Syrian refugees might start going back to Syria because the situation, in some parts of the country had stabilized a little bit. And, essentially, and of course, many people wanted to go back to their home if it was safe, with all these conditions. But now with COVID and with the situation having gotten worse and with the economic crisis, no one's going home. So you still have all these refugees in the countries and millions of people still in need in Syria.
Thank you, Jennifer, for your take on the crisis. Our next interviewer is Zeynep Bashankarud Khan, UNFPA Assistant Representative at Turkey's country office. She worked on several projects focusing on alleviating the impact of the crisis on Syrian refugees. So, I know you work closely with Syrian refugees in Turkey. Can you give me a brief overview of the Syrian crisis, specifically in Turkey?
Overall, it's the 10th year of the crisis now. I think it's also important to mark that. It's a decade now of the Syrian crisis. And in terms of Turkey, 6 million have fled the country, and about 4 million are in Turkey. So I think that's also important to say. And inside Syria, about 7 million are internally displaced. And the northern Syria part, we are attending to. A few million are also there, where our cross-border program is now serving. Inside Turkey, in 2014, I think this was an important milestone. The Turkish government issued the temporary protection law. And under this law, all of the Syrians that have been registered inside Turkey have the right to access public services, be it education, health, social services, judiciary, you name it, like any citizen. I think that's an important thing that needs to be recognized. But right now, there are 3.6 million registered Syrians inside Turkey, and some probably unregistered, and also some non-Syrians. So with the temporary protection, they have access. They don't have access. They have the right to access. And in 81 provinces of Turkey, there are Syrian refugees right now, but they're mostly densely populated in around 25 provinces. Istanbul, Ankara, Izmir, Gaziantep, Şanlıurfa, Hatay, Mersin, these big cities being the ones that have the most refugee population. But what the issue is, even though you have rights, you might not have the actual access. And because UNFPA works particularly on health and the SGBV, sexual and gender-based violence component, in that two sectors, we've identified a lot of issues in terms of access, particularly with regards to sexual reproductive health and gender-based violence, prevention and protection.
What would you say are some issues Syrian women and girls face when they come to Turkey?
Well, fertility is very high among the current population inside Turkey. And we have a nationally representative survey, by the way. The DHS, the Demographic Health Survey, that's done every 5 years, has included, in the last round, included Syrians as well. Okay. And so about every Syrian woman inside Turkey bears about 5.3 children. So it's around 6 children per woman.
Wow.
So that's a lot.
A lot.
And modern contraceptive rate is around 25%. So it's very low.
Yeah.
To give you a comparison, fertility is around 2 per woman in Turkey. And contraception is close to 50%. Modern contraception, by the way, not traditional methods. So it's like half of that.
Wow.
Child marriages, marrying under 18, the age of 18, is also quite prevalent. It's 44% among Syrian women. So almost, again, half of the women have married before 18. And what is even worse, that's a result of child marriages, is 40% have been in adolescent pregnancy. So 40%, that's also. So you get married and then you have children. at the age of, earlier than 8.
What causes this increase in child marriages?
Well, due to economic reasons, social, cultural reasons, you see that a lot of children are being married. And then comes the pregnancies. And we know that child or teenage pregnancy is very risky compared to an adult.
Of course.
Getting pregnant in terms of, many issues like, stillborns or premature births for the mother, but also for the baby. And we know that they don't have access to any kind of family planning. So it's a continuous cycle. They give birth, then they get pregnant again and again. And how do you empower such women or girls? So that
and the older they are, the harder it must be to change their mindset or change the way they see things. What would you say contributes to the increased rates of gender-based violence or the need for humanitarian aid, or just contributes to these cultural problems?
There are a lot of factors, but from our angle, education is an issue. Half of the Syrian children are in education in the Turkish system, but half are not. And we know that particularly girls are not part of the education. They are married early at a child age, and they start having children. And how do you empower? We know that if you're part of a child marriage, if you have had a lot of kids, then your likelihood of being subject to domestic violence is higher. Your vulnerability is much higher. We don't have a nationally representative data on gender-based violence among Syrians in Turkey, but for Turkish women, it's close to 40% physical and sexual violence. So 4 out of 10 women have experienced it in their lifetime, unfortunately. And also, we think that this is a underrated data, by the way. So we can safely project, and this is quite, aligned with the overall global 30% of women, experience violence. So we can safely say that it's probably higher Syrian women that are experiencing gender-based violence in Turkey. And as a refugee, as a migrant, you have much more vulnerability. If it's a woman-led household, a single mom, all of that increases your vulnerability.
Yeah, the more marginalized you are as a group, the more vulnerabilities you would have. So what is UNFPA's response?
We have 2 angles, as I said, health and protection. And under health, we have SRH, sexual reproductive health. And under protection, we have gender-based violence prevention and response and empowerment elements. Half of the health system in northern Syria is not functioning. And so there as well, we're establishing or supporting health clinics so that the sexual reproductive health component, antenatal care, newborn care, family planning services, clinical management of rape, psychosocial support for gender-based violence, all of these services that are not there, UNFPA with partners on the ground are establishing them. Also, coming to our mandate, information on health, like family planning, they've never heard of it, some of that. Like contraception, where can one get it? Like basic childcare, newborn care. There are so many things that needed to be corrected, misinformation, culturally, fed issues like that. But also psychosocial support. They've come with a lot of trauma, a lot of family members that have been killed, that have been tortured, they themselves have been raped or so. And then they carry it. So you need to provide psychosocial support, or at least some roots, for them.
Otherwise, it'll just make it impossible for them to fully integrate into the society.
Yes.
How would you say have the Syrian refugees dealt with the COVID in Turkey? Have they been able to get the vaccine?
And we turned into a appointment-based, so that we don't have crowds in the rooms, in the waiting rooms, and all of that. We've adjusted. It slowed down the figures, obviously. But we've also worked on preventing and responding to COVID. So a lot of COVID information on, how to wash your hands, what to do, the social distance, all of that. Through, the 500,000 people that we're touching, we started embedding that information too, because they really don't care. COVID is not their primal.
They have so many, like, they come with, like, like you mentioned, all this trauma, all these problems. They're refugees.
Yes.
Like, they probably did not care for the pandemic.
And they didn't know. I mean, like, there are many people that really still don't believe. In here, if they fall in the eligible group, like in terms of age or high risk group or so, they can get the vaccine, but they don't want to. So they're afraid that, or they don't know. They have no idea that they have such a right or so. So that kind of information, we're also trying to do the risk communication and inform them wherever we can.
It's great that they are able to have access to the vaccine. I think that's already a good start. What more do you think needs to be done to improve the situation in Turkey?
A woman to be able to control her fertility, I think it's one of the most important things. So access to services is important. Having rights is something, but access to services and focusing on the most vulnerable. Refugees are most vulnerable, but there are the most vulnerable groups. But during the lockdowns, a lot of women's NGOs, some research centers, documents, and the ERs, the emergency response centers of hospitals, like in Izmir, they've noted an increase of physical violence,
like domestic abuse,
40%. It has increased a lot.
Wow.
It's the same for refugees probably as well.
Yeah. So you'd argue then that, like, what needs to be done or worked on more is, like, focusing on providing, like, access to basic services and focusing on, like, vulnerable and marginalized groups.
Yes, definitely. These two, and working on the negative impacts on COVID. I mean that there might be need for other lockdowns, and so
it's not going to go away anytime soon.
Probably, and it does increase domestic violence and gender-based violence, and access to services, sexual reproductive health, the family planning, all of that gets disrupted. So a lot of unintended pregnancies that might lead to abortions. I mean, there are a lot of estimations, and you can never tell, but probably half of the population will stay in Turkey. So more interventions on social inclusion, social cohesion needs to be done. And the more access you have to services like education and social services, and so it's then the more social cohesion you would have, more interactions with the communities. But then the communities also have their own problems, so you have to attend to both.
You have to work with the local communities and the incomers into the local communities.
They're no longer incomers, though. I mean, they've been around, but
that's true,
for a while. But in the meantime, there are a lot of babies, a lot of Syrian, children growing up in Turkey that have been, born in Turkey. Their integration is important. Empowerment is also important. But how do you do that in a shrinking economy, in the pandemic? And it's a very difficult. It's a difficult situation. But I mean, I think focusing, like all of the UN agencies, focusing on what they do best and trying to sustain their impact. I think that's important. And what we do is on prevention and response to GBV and improving the sexual reproductive health status of women, girls, and vulnerable groups.
Thank you, Zeynep, for your time. Our next interviewee is also speaking directly from Turkey. Please welcome Kadir Beyaztaş, Deputy General Coordinator of the Association for Solidarity and Asylum Seekers and Migrants, also known as ASAM. ASAM, established in 1995, is the largest NGO in Turkey to support refugees and asylum seekers from conflict zones like Syria. They have implemented several projects with UN agencies, including components on gender-based violence and response to refugees. Since you work very closely with Syrian women and girls in Turkey, how would you say the pandemic has affected them?
Well, actually, COVID-19, we can briefly say that clearly has had a very bad negative effects on lives of refugees in generally. We can say that it has worsened their physical, psychological, and economical condition. Many refugees lost their jobs. Refugees who don't know the Turkish language in terms of social cohesion and who have little opportunity to integrate, into the society worsened psychologically when they were locked in their homes. We can say that this in turn increased the risk levels. For example, a refugee who used to be at medium risk is now mostly likely to approach the high risk category. This increased the effects. This increased the effects of the isolation. Losing their jobs made it very difficult for them to access basic food and hygiene kits, hygiene items. Many refugees unable to pay their rents. Refugees with serious problems had very limited access to hospitals, so their health problems worsened. The number of the cases with health problems increased, especially among the women and girls also.
How had you had to adjust to the pandemic when implementing your projects?
Our service providing style had to change. Face to face have to turn into the phone to phone, or online to online. So it is very difficult, especially for the psychological cases. It's very difficult. This kind of communication is very difficult because face to face counseling, face to face interviews are very important for establishing a trust relation. If we talk about the GBV and domestic violence under the pandemic, we can say that with the start of the pandemic process, the curfew and other COVID-19 preventive measures bring safety concern on increasing the risk of gender-based violence, which already exists in the society. It especially affects the individuals with the risk of being exposed to violence since they have to stay at the same house with unaccepting or abused family members or partners. However, identification of the SGBV survivors or risk group was one of the major challenges for most of the service providers during the pandemic process because the risk assessment are conducted through remote counseling is very difficult.
So what exactly makes the identification of gender-based violence survivors difficult?
The main reason behind the challenge of the identification of GBV survivors or risk group is that they are not able to speak freely on the phone about violence-related matters due to the presence of other household members, partners, or husbands, etc., who is the perpetrator. So this is important. In addition, individuals who have the risk of the GBV are in need of urgent intervention, are referred to the violence preventing and monitoring centers under the Ministry of Labor, Family and Social Service.
What do you predict will happen in the future, and what do you think needs to be done to improve the situation in Turkey?
In the future, actually, as I said, we need to prepare ourselves very well because in the future, after the pandemic, we will come to face with the results of the pandemic very well. All the negative results of the pandemic will be apparent, will be very clear and very close to us. People, refugees have to again regain their lives, recover their lives. I think negative coping mechanisms are frequently used, I think, in this pandemic session. So we will identify and come across with the results of this negative coping mechanism. Child marriage, for example. Child marriage is a negative coping mechanism among a family. Really, it has a commercial side, it has other sides. So there will be too many things. And in Turkey, for example, pregnant women or children this is the healthy problem because due to the pandemic and due to the law, they don't go to the hospital for a birth, but they go underground places so this is very dangerous. After the pandemic, the situation will be more clear, I think.
The pandemic has only worsened Syria's existing problems and made it more difficult for Syrian women and girls and other vulnerable groups. Thank you, Kadir, for your time. This concludes the podcast. Thank you for listening.
Thank you for listening to this episode of Human Rights Magazine. The podcast is brought to you by the Upstream Journal. I invite you to consider supporting the program and the magazine with a contribution through PayPal as you explore other episodes. Thank you for listening to this episode of Human Rights Magazine. The podcast is brought to you by the Upstream Journal. I invite you to consider supporting the program and the magazine with a contribution through PayPal as you explore other episodes.